Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. When we come back, we'll be discussing how you can overcome the fear, paranoia, and anxiety that many people experience when considering dental treatments through sedation dentistry with Northern Virginia's top cosmetic dentist, Dr. Michael Chung. Dr. Chung has created smile makeovers for many models and celebrities, is among only 1% of all dentists in the country who has advanced training in neuromuscular dentistry, and is a member of the American Academy of Cosmetic Dentistry. He is also a graduate of Johns Hopkins University, has received his doctorate of dental surgery from the University of Maryland, and has received extensive dental training at the world-renowned Las Vegas Institute for Advanced Dental Studies. Welcome back to A New Me. We're here with Northern Virginia's top cosmetic dentist, Dr. Michael Chung. Welcome, Dr. Chung.
Thank you, Rocco. It's always my pleasure to talk to you.
Oh, it's our pleasure to have you back with us. Now, today we're going to be talking about something that we received a lot of emails from viewers who have a question regarding, because a lot of people have fear and anxiety, apprehension when it comes to thinking about, let alone going to see a dentist and going to a dentist. However, the sedation dentistry certainly is something that can help alleviate that and overcome that. And that's what I want to discuss with you today. And if you could start right off the bat by telling us what exactly is sedation dentistry.
Yes, Rocco. Sedation dentistry is basically dentistry under a pharmacologically induced state where the patient is alleviated completely from fear and anxiety so that they can have a very enjoyable experience at a dental chair versus, a lot of anxiety and fear.
And how exactly does it work, Dr. Chung?
Oh, it's very simple. The patient is basically sent home with a sedative, and they will take this pill the night before they come in, and that usually will get rid of their anxiety and give them a good night's of sleep, and they come in very relaxed. And once the patient arrives at the office, we will give them a different additional medication, and then we will start immediately on a monitor called a pulse oximeter, and we will monitor them. And once they achieve adequate amount of sedation, then we will start the dentistry.
Do we actually fall asleep?
No, actually, patients believe that they were asleep because part of the side effect of the medication is amnesia. So the patients do not remember much of their appointment, and this is a good thing because a lot of patients do not want to know what happened, and so they have very positive memories or very little memories, but when they do, it's nothing negative that they'll remember. And so they believe that they were asleep, but they're actually in a dreamlike state.
Very interesting. Now, as far as being responsive, though, while they're under sedation, can a patient still be responsive to the dentist?
Yes, it is our goal always to reduce the level of consciousness, but we do not want to put them to sleep because we want them to be able to maintain their own airway, and we want them to be able to respond if we need to have them, bite into something or what have you. And patients are able to do that.
How long can a patient be sedated? I'm sure it varies depending on the treatment or treatments that a patient's going to be undergoing that particular day, but on average, is there like a typical length of time that a patient can be sedated up to, for instance?
Yes, we can safely sedate a patient up to 8 hours, no problem. But most of our procedures last less than 6 hours. But the good thing about it is that the patients don't remember anything, and they believe that the 6-hour appointment was actually only 1 hour.
Because they were under, basically, so they don't even realize how long it took.
That's right. They're in a dreamlike state.
That's a nice state to be in. That's what allows some folks to actually make it into the dentist chair, right?
Yes.
Now, let me also ask you, you mentioned a bit earlier as far as safety. I have to ask you, how safe is sedation dentistry?
Sedation dentistry actually has an excellent track record. It's been practiced for over 30 years now, and because the patient is maintaining their own airway and breathing on their own, it is extremely safe. And as an extra precaution, we have a pulse oximeter that will constantly monitor their blood oxygen saturation as well as their pulse, and takes their blood pressure every 5 minutes.
So it sounds very safe based
Absolutely.
on that.
Yes.
And as far as any side effects, can there be any side effects from sedation dentistry?
Well, the few side effects that it does have are actually all good things. One I've already mentioned about amnesia, and it's not such a bad thing that the patients don't remember that appointment, because that's the reason they were under sedation. And the other thing is sometimes the patients suffer from dry mouth, and that's good for the doctor because it's a much better working field for us when the patient's mouth is dry.
Now, who's a good candidate for this type of dentistry?
Well, obviously the patients who have high fear and anxiety, who may have put off years of dentistry, who's embarrassed to go see a dentist, who's afraid that it would take many, many hours of dentistry. These are perfect patients for sedation dentistry. Some of the other patients are patients who have fear of not being able to get numb, because there are some patients that are hard to get numb. These patients are perfect because they're much easier to get numb when they're sedated. There are some patients who have strong gag reflex. Those patients will lose their gag reflex under sedation so that we can take impressions and things. And there are some patients that suffer from TMJ or some muscle problems in their facial area that can't keep their mouth open for a very long time due to pain. These patients are perfect because the muscles are relaxed.
Now, as far as limitations go, Dr. Chung, are there any limitations as far as the type of procedures or treatments that one can have performed on them while under sedation?
Actually, it's the contrary. Under sedation, many more procedures can be done, and certainly we can work on them for longer periods of time. So it's actually the opposite.
Now, we only have a few moments left, and I wanted to ask you if you have any final thoughts that you'd like to share with all of us.
Well, I know there's probably about 30% of the population out there, which basically equates to, I believe, 90 million people out there that are putting off seeing a dentist due to fear. They should not fear dentistry because with sedation dentistry, it really is a dream, and they really are in a dreamlike state, and it's that easy.
Well, that was certainly very informative, Dr. Chung, because after all, we all need to go to a dentist. You can't go a whole lifetime without visiting a dentist, and certainly it's even ideal to visit a dentist regularly, not just for the maintenance, but if we want to enhance our smile or make other improvements and feel better, certainly we need to go to a dentist, and sedation is certainly one way that would help us overcome the fear and anxiety that many of us have. And it was very informative again, and I want to thank you for being a guest with us, Dr. Chung, today on A New Me.
Thank you.